Hey guys, Dr. Eddy, Dona, specialist plastic surgeon. As promised the other day, going to be doing a Q&A today. So answering all the questions that have been kindly sent in. Thank you very much. But doing so in different topics. So for this video, I'm going to be talking about or addressing all the breast-related questions that have been sent in. But I'm not going to be going through each individual question because many of the questions were based on the same sort of theme or based sort of subtopic. So I'm just going to be covering all the aspects of breast surgery and sort of ticking away questions or question subtopics as we go along. I do have a whole bunch of those questions in front of me, so I'll be referencing down here to make sure I don't skip or overlook anything. So let's kick on. Now, silicone or saline implants. What do I use? Almost exclusively silicone. A rare occasion saline, but pretty much silicone gel. You'll find most Australian surgeons use only silicone. Looks better, feels better, etc. A lot of American surgeons tend to choose saline for whatever reason, but yeah, silicone gel is what you're going to see the vast majority of Australian surgeons using for the reasons stated. Round or teardrop implants, which are best? Interesting question. It depends. So they both have their pros and cons. Now, some surgeons will go throughout their entire career only using rounds. Some surgeons will only ever use teardrops. Some, like myself, will use a bit of both, depending on the patient. And over the last few years, a lot of surgeons who have used teardrops have now been switching over to rounds for a variety of reasons. Either way, so there's no right or wrong. They both have their pros and cons, etc. In the end, you have a look that you want, get assessed by your surgeon, and see what they recommend for you. Now, if it's not the implant style that you want for whatever reason, then you should get a second opinion. Don't ever hesitate for any reason to get a second opinion. So, yeah. Do implants need to be changed every 10 years? Now, I do get a lot of patients coming to me who had surgery elsewhere 10 years ago and say, okay, time to get them changed. I'm like, do they look good and feel good? And the answer is usually yes. I'm like, okay, well, don't change them. There is no expiry date in implants. As long as they look good and feel good, nothing ever has to change. So, I mean, they shouldn't be considered lifetime devices, but at the same time, like I said, there's no expiry date. So that's a really important point. Now, whether it's 10 years, 5 years, or 50 years, things are going to change over time. You can get potential issues with the implants, and of course, your body is going to change, and also your aesthetic preferences are going to change. So for those reasons, you may want to get something else done in the future, but no, there is no such thing as an expiry date for implants. That's an important point. So who gets the best long-term results? Well, with implants. Implant issues aside, the women who get the best long-term results after implants, are those who start off with very little. They've basically got minimal breast tissue, and in the end, we find an implant appropriate for them. And all they've got is literally skin and nipple sitting over an implant. And that creates the breast look. And forever and a day, they end up with breast which every woman wants, but unless you're starting off with very little, you can't get that. Now, when you've got a lot of breast tissue, implants are not. That's what's going to change. That's going to drop, it's going to sag, etc. And there are certain life events, weight fluctuations, kids, etc., and just generally time in general, that's going to accelerate that. But yeah, so that's a really important point. So, because of the natural changes that will occur with you over time, you may want something done in the future to change your look. But yeah, there is no expiry date for the implants. Now, what pocket is best? What pocket is best? That's referring to where should the implant go, on top of the muscle or under muscle. Now, a number of years ago, 5 years ago, in fact, I created a video animation that addressed this particular topic. And we talked about the different types of implant pockets and what they all mean and visually what it all looks like, and explain the different things there. Now, once again, surgeon preference. Some surgeons go throughout their entire career going over the muscle. Many surgeons spend their entire career only going under the muscle. For the vast majority, go under the muscle. On some individuals will go over the muscle depending on certain lifestyle factors, etc., but almost always going under the muscle. But there are different types of under the muscle pockets, which leads us to another common question is, what is dual plane? Interesting topic. Now, dual plane. Dual plane basically means under the muscle, but there are different types of dual planes. And once again, by the way, if you're watching this on our YouTube channel, there's going to be a link below to a whole bunch of subtopics on videos that I've created in the past. So that video animation that I talked about with regards to implant pockets, you'll find that in the link below. And in that video, I basically demystified dual plane and explain the different types of dual planes and what it means, and the effects on your breast, etc., and your looks, or potential, I should say. And that's really important. That's become an important educational tool for those researching breast implants and for surgeons who are conducting breast implant surgery as well. So I do advise you and encourage you to check out that video link on implant pockets down below, because it's a big topic. Now, recovery after breast surgery. All right. What do I tell my patients who are having breast implant surgery? Here we go. So whether it's implant surgery, breast lift, implants, small breast reductions, the patient goes home the same day. There are no drains. I don't insert any drains for any of those patients, except for large breast reductions I do. But no drains for a breast implant surgery. Go home with waterproof dressings on. There's no stitches that need to come out. You've got a surgical bra on. You've got pain medication. You've got antibiotics. Go home and chill out. Now, you're going to be sore. Some women are very sore, and they're, very sore. Others who are not very sore at all and thinks everyone's just a whinger. So there's a broad range of normality. Some general guidelines that I tell everyone is, first 5 days don't drive. After that, use your common sense. If you feel safe to drive, you can drive. If you're working in an office environment, back to work, doing some light work in a week's time. As far as any heavy lifting is concerned, anything too physical, too strenuous, going to the gym, heavy lifting, etc., as much as practical, you're going to avoid for the first 4 weeks. Now, a lot of women with young kids, of course, life goes on. You're going to be doing things to, look after the kids, keep them out of harm's way, keep them comforted. You're going to be doing that, but keep it to the bare minimum for the first 4 weeks. After that, I pretty much say to you, you're beyond the point where your actions could potentially compromise your results, so you're free to go out and physically attempt whatever you like, attempt being the key word, because you're going to be sore. Common sense, you're doing something you saw, you're going to pull back and work around it, and week by week you get better and better, and eventually you've forgotten you've had the surgery. But eventually it takes a long time, 3 to 6 months, so you always have to be patient when you're a patient. The other thing, for those who go to the gym and train a lot and do lots of exercise, well, you have to be patient. At 2 weeks you can sort of walk on a treadmill, walk with some sort of attitude and purpose, but wait for 4 weeks before you actually get back to training. You haven't trained for 4 weeks, so you're going to be deconditioned, so start very light, short sessions, and gradually build yourself up week by week until eventually you get back to doing your normal stuff. That's really important. Now, in the beginning, you're very swollen up here and quite swollen through the midline, through the cleavage area. So ignore how you look in the beginning. We typically see all of our patients back in our office, local patients within Sydney, at 1 week, 3 weeks, 6 weeks, 3 months, 6 months, 1 year, and any time in between, as required, if required. So 1 week we would see you, we'd change your dressings, check your wounds, make sure things are okay, get you to start massaging in here to start to define your cleavage, and just generally make sure you're behaving yourself. 3 weeks post-op, dressings come off and stay off, and talk to you about scar management. After 6 weeks post-surgery, most of your swelling is gone. Then you can enjoy the process of going shopping and buying yourself some new well-fitted bras and clothing. But prior to that, you wear the surgical bra we give you, maybe have yourself 1 or 2 inexpensive sports bras or crop tops, so you got something to wear when you're washing the other. But it does take 3 to 6 months for things to fully soften and settle. That's when we finally sit back and say, yep, or do we need to do anything else to improve it, which is for a breast augmentation is pretty uncommon. There are some operations such as a combined breast lift augmentation that does have a higher need for further surgery. But once again, we wait till 6 months before we critically review it and before we'd actually do anything. So that's really important. When it comes to the implants, they're not fragile. People often ask, are they fragile? They get concerned about, handling the breast, etc. Implants are not fragile. So you do your normal activities, etc. Now, implants or not, gravity hates big breasts, always dragging them down. So it's really important, implants or not, to always wear good, strong, supportive bras. Basically, you need to continually support your bras all the time. Obviously, certain occasions and outfits, you're going to not want to wear a bra, but keep it limited to those certain occasions and outfits. You support them as much as possible. They'll look after you for as long as possible. And that is really important. A lot of girls get breast implants and think, great, now my breasts are full and perky, I'm not going to wear a bra anymore. And that's the worst thing you can do, because gravity is going to continually act and continue to want to drag them down. And you want to avoid getting a breast lift. So do support your breast. That's really important for maintaining your results. Now, what other questions do we have here? That's recovery questions. Wearing bras, we talked about. 6 months to fully settle. Pain after breast implants, we talked about that. It can be quite bad, it can be quite minimal. Everyone's a bit different. But pain can be a long-term thing. Some people get intermittent pains here and there, which can go on for months or even years. And occasional pain here and there is not uncommon, but there are this very, very small subgroup of women who end up with, quite irritating pain, debilitating pain. So whether it's a very localized to one area or more diffuse. And And that's a really difficult thing to deal with because typically there's nothing else going on. The breasts look fine, they feel fine. You know, you can do tests, all the tests in the world. You're not going to find anything wrong with them. But there's clearly been some sort of nerve irritation which is causing them some pain. And how you deal with that, well, that's a troubling area. So there are certain things you can look at, certain medications you can try. But ultimately, if someone has ongoing debilitating pain beyond 12 months or more, and sometimes it can be late onset, by the way, as well, then you have to give consideration for removing the implants completely, which is not a decision to be taken lightly, of course. And the other thing is, removing the implants in that situation does not guarantee that the pain's going to go away. So it's a difficult topic. Fortunately, it only applies to extremely, a fraction of 1% of patients, but it's something that you do need to be aware of as well. Babies and breast implants and all the things related to that. A whole bunch of questions along those lines. Okay. Implants. Whether the implant's going under the muscle or over the muscle doesn't affect your ability to breastfeed. Okay, that's really important. And implants themselves don't affect the milk quality as well, which is actually a question we get asked quite frequently. So you can still breastfeed after, or potentially breastfeed after implant surgery. Now, should you get the implants done before having kids or after having kids? Well, that's a decision only you can make. It depends on how much it's bothering you with respect to having a smaller breast. If you want to have fuller breast, do you want to wait until after kids or not? Only you can assess that based on how much it's affecting you. But having kids, or pregnancy and having kids and or breastfeeding, how is that going to affect your breasts? And will you need more surgery after if you have implants? Well, that depends entirely. Going back to what I said before, when you've got a lot of breast tissue, then almost certainly those certain life events is going to affect your breast tissue enough so you may want to have further surgery. But if you don't have much breast tissue to start with, then it's unlikely things like that are going to affect your breast tissue or cause them to droop. So you may not require further surgery if you've got implants and you have kids and you breastfeed. Depends on a multitude of things. What I generally say is if you want to maintain your results, okay, you wear good, strong, supportive bras all the time, which is important. Maintaining a healthy body weight throughout life is really important. And if you get pregnant, then see a nutritionist and a personal trainer experienced in pregnancy to ensure you put on a healthy amount of weight. And that's giving you, and I never say don't breastfeed, but understand if you're breastfeeding, your breasts are going to be engorged for longer, so therefore they're likely to change a bit more. So all these things are giving yourself the best chance of maintaining a good result, but independent of weight gain and all the rest of it and whether you decide to breastfeed. Some women, the moment they get pregnant, their breasts just balloon out, so they're hormonally very sensitive, so breasts are going to grow a lot, and obviously that's something you can't control. So there is no right or wrong, depends on what's bothering you, when do you want to have implants, and whether you're prepared to potentially have further surgery after kids, because you may need a breast lift. But with or without implants, you may need a breast lift regardless. So yeah, there's no right or wrong. It's something to be discussed and something which only you can decide once you've been given all the information relative to your specific needs and desires. So in other words, you need a consultation to work out what's best for you. Nipple sensation is a common question. Now, what I tell my patients is, after surgery, nipple sensation can become too sensitive and painful or completely numb, so no feeling at all, and that can affect one or both breasts. And typically you do get altered sensation in the beginning, but usually by 12 months, most women, the sensation is back to normal, but not all. A good 10% of women end up with permanently either too much or not enough sensation in one or both breasts, and you can't change that. And also, it can affect the sensation to the rest of the surrounding breast skin, but typically the nipple is the main area that we worry about, but yeah, you need to be aware of that. The other important topic is relates to breast self-examination and breast cancer. Well, number one, implants don't cause breast cancer. That's been proven time and time again. But implants are not. I tell all my patients, every month you need to be examining your breast, examining for any abnormal or changes to your breast, any lumps and bumps that may warrant further investigating. So implants don't affect your ability to detect changes in your breast. If anything, some would say it makes it a bit easier. So continue routine monthly breast self-examination if you've got implants, and it's not going to be any harder to detect changes if they were to arise. And when it comes to routine breast cancer screening, ultrasounds and mammograms, of course you get screened as per normal, and having implants does not affect the ability of those tests to find changes to your breast. Just tell them you've got implants in, they can work around that. So that's really important. We've discussed that. We talked about that. Now, with regards to wearing a bra, I talked about supporting your breast. Yeah, for the first 6 weeks, you wear a bra night and day. After 6 weeks, I basically say you don't have to wear a bra at night time if you don't want to. But a lot of bustier girls like to because it sort of keeps them contained. Basically, you do whatever is comfortable for you. If you find not having your breast secured, if a bra is affects your sleep, then you wear a bra. If you find wearing a bra is affecting your sleep, then you don't wear a bra. So it's a personal preference sort of thing. So yeah, that's something which you'll need to decide. Now, we've talked about that, implants and breasts and mammos and here we go, nipple sensation, areola size and nipple size. Okay, that's a common question. Okay, so getting implants make your areolas bigger? Well, yes and no. Now, a lot of women come to me who've got, largish areolas relative to their breast, and they want bigger breasts, so they want implants, and they're talking, they ask about, can we reduce the areola size? Well, if you've got largish areolas and you want to have implants, then for a variety of reasons, I would not recommend having your areolas reduced in size at the same time you're getting implants. I'll get back to that in a sec. But basically, for those women, once they've got the implant, then their breast becomes much bigger. So the areola size becomes relatively much smaller. It's less noticeable, and with extremely few exceptions, it's no longer an issue after things are fully settled down by 6 months. So, so it becomes relatively smaller compared to the rest of the breast, because the rest of the breast becomes substantially bigger. Realistically, it probably does increase slightly in size, marginally, but not a great deal. So, after 6 months, however, once things are fully settled and softened down, if that person is still concerned about the areola size, then it's perfectly fine to then go ahead and reduce the areola size. So there'll be scar around the areola to make it smaller. Because at that point in time, it's far more likely to stay reduced in size. If you were to attempt to do that at the beginning when you're first putting the implants in, then you're less likely to get an effective result, because basically what that means is you put an implant in, the entire breast is under a lot of tension. At the same time, you're trying to make the areola smaller, so you're doing two completely counterproductive things. So in the end, it becomes a tug of war between the thick skin and the areola skin. The areola skin is the weakest part of the breast, so inevitably that stretches back out to become at least as big, if not larger than it was before. So all you've done is given that patient a scar around the areola. It's not smaller, if anything it's bigger, and you've achieved nothing. So that's why I'd wait for at least 6 months, and then if it's still a concern, that's when you'd reduce the areola size. What else we got? Scarless breast lift. Scarless breast lift is a common themed question. What's a Scarless breast lift? It's nothing. It's a breast augmentation. It's a term which a lot of surgeons like to use. Occasionally I have used it, but really it's a non-event. So basically the breast lift is where you got a scar around the areola, plus or minus, down and through here. So you've got additional scars in your breast. And breast augmentation usually is the scar in your lower breast fold. Now, a lot of women have droopy breasts, and they've been told they need a breast lift, or they think they need a breast lift, but with a well-planned and well-performed augmentation, you can create a significant lift without creating scars on the breast mound. In other words, just a routine augmentation scar. So that it generally would be referred to as a scarless breast lift. Of course, it's still a scar in the breast fold, but there's no scars in this breast mound. And there are lots of women who come to me who think they're needing a lift, and I'm like, no, we can give you a result with just a routine augmentation, done well, that is. So that's what a scarless breast lift refers to. It's not a particular operation, it's just a well-done breast augmentation, to be perfectly honest. Having said that, when it comes to breast lift, that's a really big topic, and once again, check out the links below on the YouTube channel, because I have 3 videos where I talk at length about breast lifts and all the different types and the variables and the things that need to be considered when undergoing a breast lift. What else we got? Implant pockets that have stretched too big. Okay. An implant goes in, the surgeon creates a pocket to accommodate the implant. They make the appropriate size implant pocket to create that chosen implant. Okay, so the implant doesn't move around too much. But sometimes the implant can end up moving around way too much, and when the person lays down, the implant sort of slides down through here, etc. There are 2 general reasons why that would occur. One would be because the surgeon made a pocket which is way too big for that patient's implant. Okay, that's one cause. The second cause is when the patient has breast tissue envelope, in other words, skin quality and breast tissue quality, which is really very soft. Doesn't have much elasticity. It's basically just weak tissue. And even though the pocket is created just the appropriate size, the implant itself has just continues to, because of its weight, continues to affect the envelope and stretch things out. So before too long, the implant's just moving around too much. That's a reflection of the person's sort of anatomy or their tissue quality. And some people's are more prone to that. Obviously, genetic component to that. There's those who have lost massive amounts of weight. There are those who have, very soft breast tissue due to pregnancy, multiple pregnancies, or pregnancy in general. So that's a very difficult thing to treat, because in the end, whether someone's got a large pocket for their implant, whatever the underlying cause is, what do? Well, you've got to tighten up that pocket, make it smaller. So you've got to operate via the same scar, typically, to tighten up that pocket. But if the cause of that was due to generally weak tissues, well, that's still going to exist afterwards. So there's a very good chance it can come back again. That needs to be carefully considered and discussed, and consideration for either no implants or much smaller, therefore a lighter implant, which will have less of a weight on the implant. And also strongly advising the patient to always wear good, strong, supportive bras, because that may have contributed to the stretching by not wearing a bra all the time, and therefore relying on the breast tissue envelope to support an implant, which it just can't do. So it's a difficult problem. Different causes, and depending on the cause, will dictate what needs to be done. It can be addressed, but it just depends on the underlying cause, and it can become quite complicated. Other question relates to interstate patients. Well, we get a lot of interstate patients and rural patients. How do we treat them? Well, like everyone else, of course, but obviously we're not going to get them back at those regular time points that I mentioned before. But usually they can fly home with it. But we do maintain contact at those regular time points to make sure they're hitting the right recovery milestones and things are doing what they should do. And of course, anytime they're back in Sydney, they'll pop in and see us and we'll just say hello and make sure things are coming along okay. So we do treat a lot of interstate and rural patients for these operations. It works very, very well, that system we have. Surgery on fuller figured patients. Do we do that? Well, yes, we do. When someone's a fuller figured or high BMI, yes, a lot of surgeons won't treat those patients because they find them to be too difficult. But at the end of the day, you've got to treat the individual as the individual. How they are is how they are, and if they wanted certain things enhanced, then you deal with that accordingly. Yes, someone with a higher BMI does have increased risk of certain anesthetic issues, and surgically it does become a lot more difficult, not going to pretend. But as long as they're discussed with the patient and they're aware of all that, then once again, you have to treat the individual as the individual and how they are. It's not for me to say, go away and lose a whole bunch of weight if that's not the weight they aren't always going to be. So that's a really important point, which, everyone needs to be aware of the potential increased risk, but they can still have surgery and be the way they want to be. That's important. Waiting for further surgery. Like I said before, it takes 6 months for the results to fully settle. So that's when we basically sit back and critically review the results and whether we want to do anything else. So what's anything else? Well, not that uncommon, not for my patients, but not that uncommon for the patient to say, I now want to be bigger, or on a rare occasion, smaller. So either way, whatever the issue may be, you wait until 6 months before you would do anything to fully appreciate the final results and then determine what, if anything, you need to do. And that's when you do it. So you wouldn't do anything prior to 6 months unless that patient has a particular significant complication, which is fortunately extremely rare. Otherwise, you wait till 6 months until you got a fully settled result. That applies to breast augmentations, breast lifts, breast reductions, etc. All the same. Okay, what else we got here question-wise? Fat transfers to breasts. Okay, do I do them? Yes, I do. Do I do them often? No, I don't. Why not? Because it doesn't work that well and it doesn't give the desired results. Let me clarify that point. Now, fat transfers to breast. You take fat from elsewhere, doing liposuction, and you're injecting the fat into the breast to make them fuller. Okay, it can work quite well, but it only achieves a very, very small enhancement. And the most that I inject will be, say, 150 or so cc's. And when it comes to fat transfers, and that's a very, very, very small implant. The smallest implant I got on my desk, what's this? That's a 180 cc. That's not a great deal. So it'll be smaller than that. So it's not much at all. But when it comes to fat transfers, a lot of the fat doesn't survive. In other words, the body will sort of break that down. So a lot of the fat won't survive, and then you potentially end up with one breast losing more fat than the other breast. So you end up with potential asymmetry issues, etc., and often requiring several operations to get to the final result. So ultimately, you're never going to get the fullness that you're after, You have unpredictable fullness that you're going to achieve. You have issues with liposuction as well. So there's a lot of potential issues with fat transfers. So I'll reserve that procedure for someone, for very, very small, finite group of patients, simply because I can give them a far more predictable result with a well-planned augmentation appropriate for them. Other questions relating to, or someone in particular asked a question about getting fat transfers after breast augmentation sometime afterwards. Well, the question I'll have to ask back is why, and what's wrong with the breast implants you've got? Because the implant done well should be addressing all your concerns. Yes, of course you can have fat transfers in addition to breast implants, and you can get it done at a later date, but I'll be wanting to know what's the current problem that the person has and whether that can be addressed with a change or an adjustment to your implants. So yes, you can, but what's wrong with the implants is really what I want to be knowing. There is capsular contracture is a common question. I have a lot of videos on capsular contracture. I might have a few links attached below if you want to check them out. But basically, every implant has developed a scar tissue capsule around it. So you get the scar tissue forming around an implant. That's normal. That's a normal capsule. Capsular contracture, when that scar tissue capsule becomes abnormally thick and tight for reasons largely unknown. And I generally quote about 5% of people can get that. Some might quote a bit more, some might quote a bit less. Either way, it's a real thing, a real number, and a real percentage of women get that. So if it does occur, the breast becomes harder, it becomes distorted, and become even painful. And therefore, you would warrant surgery to have the implant and the capsule removed. And if you still want to have the implants replaced. So that's something you need to be aware of. There are certain things that are done during surgery to minimize the risk of that. But like I said, despite all that, there's still not an unreasonable amount of people, percentage of people can get that. So that's important. Another topic relates to, okay. I said breast implants don't cause breast cancer. That is very true. But there's a rare cancer associated with implants called ALCL. Essentially, it's a cancer of the scar tissue capsule. It's quite rare. It's only associated with textured implants, not smooth implants. I'm not going to talk much about it simply because I have about a 13 or 15 minute video where I discuss that at length. So once again, there's a link down below to look at ALCL and that type of cancer. But basically, the incidence with the textured implants will be about 1 in 86,000 or 1 in 80 plus thousand. So it's relatively very, very small compared to, say, breast cancer, for example, which once again is not caused by implants. But once again, check out the actual video where I discussed that at length. Other questions relating to someone's asking about they're allergic to a whole bunch of things, including fillers, and should they get implants? Well, realistically, there's no reason why you can't have implants, because silicon's highly inert substance used in multiple medical devices. But if you're allergic to pretty much everything, then I'll probably be thinking, I don't know if I really want to be doing this, and you should be thinking the same thing. So you might be someone who perhaps a fat transfer might be a better option for you, in light of all your concerns about allergies and things like that. And that question gets us to another subtopic of questions related to breast implant illness, which is a really controversial topic. And once again, a link below. I do have a video where I talk at length about breast implant illness, and I talk about all the different arguments for and against that being a real thing. Suffice to say that many women believe they have breast implant illness. Many women are having the implants removed because of that, and many of those women are feeling much better after having their implants removed. Very difficult topic, and once again, I do encourage you to watch my video where I discuss that at length, for those who are interested. What other questions do we have here that we have not yet covered? I think I've pretty much covered all the questions. We talked about that and that and that. I think we're pretty good, guys. Yeah, I think I've covered all the questions that have been asked, all the subtopic questions. So thank you for listening. If you have any comments, please write them below, and any questions as well, write them down below. And if I choose to make another video or do another Q&A in the future, which I will do, of course, I will get around to those questions. Thanks for listening, and we shall chat later.